Hi guys, this is Dr. Robert Purchase, orthopedic surgeon and football fanatic. I'm here to bring you my take on injuries from Week 5 of the NFL. And let's start in Detroit, where Buffalo Bills Ron Brook, he gets upended while trying to cover a punt, and he lands on the top of his head. Now this very dramatic looking play is even more scary when you realize that this is exactly how people break their neck. Now either hitting with the top of the head or otherwise getting struck on the top of the head causes an axial load on the cervical spine and can cause it to break, which injures the spinal cord within. Now fortunately in life and in football this is a rare injury, but truly devastating when it happens. The spinal cord is essentially a big nerve. Now unlike peripheral nerves like in the arms and your legs that have the potential to heal, the spinal cord is what's called a central nerve. It basically doesn't heal when it becomes injured. So when you get this axial load on the top of your head, it can break the bony cervical spine and can injure the spinal cord within. So when you think that a player may have sustained this type of injury, the primary goal when you're getting that player off the field and onto a hospital is to do no additional damage to that potentially injured spinal cord in the process. That's why it took them 10 minutes to very carefully roll Mr. Brooks onto one side and onto a backboard and get his head strapped down, so they didn't damage the spinal cord any further. Now fortunately for Mr. Brooks, he never reported any numbness, he never lost any motor function, and imaging studies were all found to be normal. He didn't have a devastating spinal cord injury, and he was able to walk out of the hospital when he was discharged. In fact, he's returned to practice on Wednesday and is probably going to play this Sunday. So this is basically the best case scenario. And if you were carefully watching on Sunday, you could see that he waved his hand as he was carted off the field. And that's a very good sign that this is going to have a good prognosis, because basically if you're paralyzed, you're going to be paralyzed at the moment that the hit happens and you never regain function. All right, let's finish talking about Calais Campbell. He's an Arizona Cardinals defensive lineman. He injured his medial collateral ligament, also known as the MCL, in their game against the Broncos. Now, ligaments are soft tissue structures that guide normal motion and restrain abnormal motion. The MCL is a ligament in the knee. It's a ligament on the inside of the knee. It restrains what is called valgus stress, where the foot is pushed outward and the knee is pushed inward. You can see how Calais Campbell injured his MCL on this play where Julius Thomas, the Denver Broncos tight end, delivers a chop block. Now this play is described by Arizona Cardinals coach Bruce Arians as the dirtiest play he ever saw. I find that a little unbelievable for a guy that likely saw the 70s era Raiders play. Some ligament injuries are more severe than others. Some ligaments need to be reconstructed while others heal nicely. Some ligament injuries can even be braced relatively easily. Fortunately for Mr. Campbell, MCLs heal pretty nicely with just a little tincture of time, and they can be braced pretty easily with a common type of brace. So expect Mr. Campbell to be back in the not-so-distant future. Well, there you have it. I'm Dr. Robert Purchase, orthopedic surgeon here in San Francisco, and that's my take on some of the more noteworthy injuries from Week 5 of the NFL. Thank you for your attention. I look forward to seeing you next week.